Nursing attendant exam questions and answers. Let's get started. The nurse aide should understand that a back massage, is it A, causes muscle spasms, or B, increases blood pressure? Could it be C, promotes circulation, or lastly D, increases the heart rate? The correct answer is C. Here is why. Gentle massage stimulates blood flow to the skin and underlying tissues, which is one of its therapeutic benefits. Proper massage should relax muscles, not cause spasms. It generally lowers blood pressure and promotes relaxation. It should not significantly increase heart rate. It typically has a calming effect. Next question. When assisting with dressing a client who has left-sided weakness, what part of a sweater should be put on first? Is it A, both sleeves? Or B, left sleeve? Could it be C, client's choice? Or lastly, D, right sleeve? The correct answer is B. Here is why. The affected, weaker side is dressed first during the process of donning clothing. It is easier to maneuver the garment onto the stiff or weak limb before putting it on the stronger, more mobile side. Putting both sleeves on simultaneously is difficult and impractical. While client choice is important, the specific technique for dressing a weak side is a standard skill. The right sleeve, strong side, is put on after the left sleeve. Next question. A client with arthritis reports difficulty when cutting the food. What should the nurse aide do to encourage the client's independence in eating? Is it A, cut the food and feed the client? Or B, insist that the client eat the meal without help? Could it be C, assist the client in cutting the food and encourage the client to use the special eating utensils? Or lastly D, ask the dietary department to puree the client's food? The correct answer is C. Here is why. This provides the necessary support, cutting, while encouraging the use of adaptive equipment, built-up utensils, rocker knives, that promotes independence. Cutting and feeding takes away all independence. Insisting on no help may lead to frustration, poor intake, or spillage. Pureeing the food is an unnecessary restriction if the client can manage soft or cut foods with adaptive aids. Next question. The nurse aide is assisting a coworker in obtaining a quad cane for a client. How many legs should the nurse aide understand that a quad cane has? Is it A1? Or B2? Could it be C3? Or lastly D4? The correct answer is D. Here is why. A quad cane has a base with 4 small legs, providing a wider, more stable base of support than a standard straight cane. A single-leg cane is a standard cane. 2 legs describe a forearm, loft strand, crutch, or a hemiwalker. 3 legs describe a tripod cane. Next question. Once a client has been pronounced dead, the responsibility of the nurse aide is to: is it A, make sure the body is clean? Or B, call the family? Could it be C, leave the room? Or lastly D, give spiritual care? The correct answer is A. Here is why. Post-mortem care includes cleansing the body, placing it in proper alignment, and preparing it for the family to view or for removal, according to facility policy. Calling the family is typically the nurse's or social worker's responsibility. The aide does not simply leave the room. Post-mortem care is provided. Spiritual care at this time is usually provided by a chaplain or the client's own spiritual advisor. Next question. A client drinks 240 milliliters of soup, 120 milliliters of coffee, and 90 milliliters of juice for lunch. The client's total liquid intake for lunch is it A, 360 milliliters? Or B, 450 milliliters? Could it be C, 480 milliliters? Or lastly D, 520 milliliters? The correct answer is B. Here is why. The sum is 240 plus 120 plus 90 is equal to 450 ml. 360 milliliters is the sum of only 2 items. 480 milliliters is an incorrect calculation. 520 milliliters is also an incorrect total. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.